Our next speaker, Telmo, unfortunately can't make it, but he has recorded a voiceover on his slide. So fingers crossed this will work and it's going to play.
For health tends to follow a certain pipeline. We train a bunch of models on a training data set. We verify their performances according to certain metrics. Whichever has the best performance, we then maybe try to understand its predictions using explainability methods to know what features it's using to make its predictions, and then we deploy it. The problem is very often models don't generalize really well for different hospitals, different populations. And I think the reason for this is that we don't really know what the models are learning or whether they are actually finding shortcuts in the data. So I think we need to teach models the same way that we teach students. We need to define intended learning outcomes so that we can control what models are learning. This can generate accountability. This is good for documentation, but also it's good for controlling what models are doing so that we know which models work well for which populations. Thank you.
So thank you to Telmo in his absence.